Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the lumbar spine. It is Schober's test. So this test came from a paper back in 1937 out of Germany by Dr. Paul Schober, and he wanted to have a way to assess lumbar mobility because he was saying that it is important to understand if a lumbar spine is restricted to help in determining what is causing someone to have low back pain. And he was saying this is a way that you can differentiate between normal lumbar mobility versus a pathological stiffness, and that is just a quick and easy way to do it. So let's get in on how to perform it. To perform this test, what you're going to do is you have the person standing, facing away from you. You want to expose that part of their lumbar spine. You're going to find that lumbosacral region, which should be around the L5-S1 segment, and you make a mark right there. Then you go up, so up towards the head, 10 centimeters, and you make a mark there. Then what you're going to do is ask the person to forward flex, to bend forward, touch your toes as far as you can go, and then you measure that distance between the 2 points. And a normal response should be over 5 centimeters or more. So it should be 5 centimeters or more of increase in motion. But if it is less than 5 centimeters, it is considered a positive. Now, getting in on the research for this test, there's not a lot out there that supports it. But I will say that this test kind of helped foster a lot of stuff with rehabilitation and helping diagnose things like ankylosing spondylitis. So it did kind of help form some of this. But like I said, there's not a lot to support it. Now, there is a study in which they were trying to determine like how good this test was and how accurate by using some devices. And so one device had these strips that they put down these person's spine, and they had sensors in it. And the other one was a handheld device that could just see like how much motion was going on. So they had them perform the test, and they used the devices to see how much motion was going on. And so for the one with the strips on it, it found that the sensitivity for this test was 36.1%, so not very good. The specificity was higher at 79%, but it did find an overall false positive rate of a 63.9, so almost 64% were a false positive. Now for the handheld device, it was found that the sensitivity was better. It was at 68%, but the specificity was at 46%, and the false positive rate overall is 53%. So really looking at it, wasn't that good. Now I will say, if you look at it, it did seem to get a little bit better and as people got older in it, but still just kind of overall not very good. They did look at another test, or another article. This was funny. They looked at the Schober's test, they looked at the modified Schober's test, and they looked at the modified Schober's test, and they compared this to CT scans. And so what they were doing, the modified test used a 10 centimeter mark up and then a 5 centimeter mark below that lumbosacral junction, and then you did the same thing. The modified Schober's test used the PSIS as the frame of reference with it. So they did all these tests, and then they used the CT scan to see like how accurate they were. And you know, lo and behold, none of them were very good. They were actually saying, with this test, is it shows it doesn't actually account for a lot of the motion of the L1, L2 segment. So this one is not too good. Maybe they need to throw at least maybe a modified Schober's in there. Just keep throwing modifications in there, whatever. Anyway, but that is Schober's test. An oldie. There's some basis in it. It does seem like it kind of helped foster a lot of things, so I thought I would talk about it. But anyway, let me know, what do you think about it? Do you use it? Have you heard it? Maybe you had it in PT school and it was on a practical. Maybe. Anyway, let us know down in the comments below. And if you enjoyed the video, please hit that like button down there below as well. I always enjoy coming up with this stuff for y'all. Put that out there. But anyway, as Mateo always says, take care of yourself. Take care of your patients. We'll see you next time.